Hey everybody, Elizabeth here, and we are now 8 days away from our move to Arkansas, and we are getting really excited, getting really nervous, and pretty much every single emotion in between those two things. That is where we are, and I won't lie, there has been a lot of really hard things that has happened in the last week. For me, not for our journey or for my husband. I mean a little bit for him, but winter and the cold are incredibly difficult for me. There's something about the cold weather and the atmospheric pressure and all of those things that make me hurt so bad and make the chronic pain I already deal with significantly worse. So today I want to talk to you guys about how I manage pain in the winter without over-the-counter drugs. That is what today's about. First of all, before I get into what I actually do, I want to talk a little bit about what it is that I'm dealing with, because everybody's pain is so different. The way that they manage pain is so different, and you really do have to figure out what is right for you, why it is that you're having the pain, and how to deal and support that versus just dealing with the pain. So for me, I have sciatica on both sides of my legs. If you don't know what that is, basically sciatica, your sciatic nerve runs from your sacrum, which is right about where your tailbone is, a little lower. There is a nerve that comes out of there. It's about the size of your pinky, that runs down from your back, down your legs, down the back of your legs, that have all the nerve endings that go to the rest of your legs attached to it. It's kind of your biggest nerve, and well, it is actually. It's not kind of anything. It is your biggest nerve. And basically I have irritation or inflammation or issues with my sciatic nerve that causes sciatic pain, also known as sciatica. I've had this for 5 years. I've known about it for 5 years anyway. I had a tendency towards it when I was younger, but never really dealt with it, and I never had enough issues with it that I had to really deal anymore with it. Also, in between my hips, I have a ton of muscle damage and scar tissue and all of that good stuff because I was in an accident when I was 16. I got smushed in between the door and the center console in my Suburban, and when I pulled myself out, because we got T-boned, it hit right on my door. I got smushed in between the two, and then it flung our Suburban around, and my sister was in the passenger seat. I got myself out to help her while we were still moving, and it caused a great deal of issues in my hips. I still have a lot of those issues. Also, recently I was in a car accident with my best friends, and we were again T-boned. Sorry, the ice is melting and it keeps hitting my window and it scares me every time. I was in another car accident, and this one didn't affect me quite as much as the last one, or so I thought. But it turns out I actually fractured my hip. And I did something to my neck that made the migraines that I have had since I was a little girl significantly worse. I get migraines maybe once a week, twice a week sometimes right now. And it's getting better the longer we are away from that accident. It's been a little over a year now. So it's starting to get better, but my hip is still really bothering me because I did re-injure it. And my head is throbbing. So with that being said, here is what I do to manage pain. First things first, I never take an OTC or an over-the-counter drug. Now, I'm not against OTCs. If you need them, use them. But I have noticed for me, they make me feel better in the moment, but later make me feel significantly worse. And so I have to keep taking them, and I'm adding all of those things to my body that are dealing with the symptom and not the issue. And I don't want to do that. I don't want to take a bunch of pills continually every day. When I first was in my accident, I had to take ibuprofen every single day. I also had to take Vicodin every day, and also a nerve blocker. Don't remember which one, but I had to take one. And they make me feel good in the moment. They totally do, and they work. And if that's what you need, no judgment on my part. But it didn't work for me long term, and I had to change it for me. So with that being said, now I use a wide assortment of things. Some of those things I do not have currently to show you, but I can describe them fairly well. And I just don't have them because we're leaving in 8 days and they're packed, which I regret with every fiber of my being, but it is what it is. So first thing I'm going to show you is essential oils. Now, I use Young Living essential oils. I trust them. I love them. I absolutely will never use anything else because I've had such great results with it. I use them because, again, they're helping the issue, not just the pain. So I will show you a few here today that I use pretty regularly that actually help like reduce inflammation in the body and work well for me, which is most of my pain comes from inflammation due to injury. So first things first, this one is called Deep Relief. This is very mentholy, very pepperminty, very strong, and I have the just essential oil of it like this for deep relief, but I found that their ratio that they do in their roll-ons is perfect for me, for carrier oil to essential oil. And it just saves me a lot of time, effort, and energy. It's so easy. I just have to grab this and go. And it's nice. This is super mentholy, so it does help like release muscle tension and like pressure to like sore muscles and all of those things. And what I found for me, and it has worked on a few other family members and friends that have tried this, it really, really helps me relax that muscle so that it's not adding to the issue. When I get into a lot of pain, specifically sciatic pain, I tend to tense up. Like every muscle in my body is tense. When I'm done with the sciatic flare, I usually am so sore, like everywhere. And this helps me just relax that and deeper breaths, and it's helpful. It's helpful. Wow, talking. It is helpful with just getting things loosened up a little bit so that the body can use natural healing methods to deal with that pain. This is a really good one. There are days that literally I just have to use some of this and then just do some yoga, and that's it. Specifically for pain, inflammation, delightfulness. This trio, my dogs are freaking out. Bartimaeus. Hey dude, what's up? All right. So you might see my dogs a little bit. Somebody is here. So anyway, Copaiba, Panaway, frankincense. Literally a lifesaver. I take frankincense internally. That's why I have the Vitality. But I use all of it on me all the time. Sorry about that. My dog's got a little out of control. There's a lot going on in the house today. I have these combined into a roll-on that again I use. So I'll use that Deep Relief, and then I will go ahead and put this roll-on with this little trio on about 15 to 20 minutes later. And this helps reduce inflammation. It helps soothe the area. I don't know fully what it does to me specifically, but I know what properties it has in them, and the big one is inflammation. And it really kind of helps that all remedy itself and feel better. And it can take a little while. Sometimes it's instantaneous. Sometimes it's 30 minutes. Sometimes it's 6 hours. I just keep reapplying. I found that it's really hard to overdose on essential oils. You can, but it's not the easiest thing. So, I use those trio. Life Savers. Get them. For my migraine, M-Grain. M-Grain has a lot of those anti-inflammatory properties that I was talking about before. Oh my gosh, there's so much noise happening in this video. I am sorry. But it has a lot of those anti-inflammatory properties that we were talking about earlier. And it smells awful. I hate the smell. It's terrible. I don't know what is in there that smells so bad because I like them all separately. It's got, where did the ingredients go? Basil, marjoram, lavender, Roman chamomile, and peppermint, as well as helichrysum. I love all of those separately, but something about the mix is terrible. It's so bad. But with that being said, it works. It brings the swelling down. It helps soothe those nerves. It really helps the nausea. I don't know if they meant for it to help with that, but it does. The peppermint probably in there. It really does help with all of those things so much that I find it to be worth it. Like, I will even go out in public smelling like this if I have to, because it is helpful and it works, and it is what it is. When you live in chronic pain, you're pretty much willing to do about anything to make it better, to make you be able to live your life. And for me, I'm willing to smell like M-Grain if it means that I can live my life and do something. So M-Grain it is. And then the last one is lavender. Now, lavender doesn't necessarily have a place in pain relief for me. I know a lot of people find that it does. It doesn't work for me. What it does work for is relaxing. Now, I am talking about this one in conjunction with my second point. Number 2, yoga. I will diffuse lavender and release, which I didn't dig out for you, but there's a one called release, and I will diffuse both of those while I am doing yoga. And I will do yoga in a nice dark room, and I will do this lavender, and I will do the release, and I will put Sacred Mountain on, and I will just focus. And this is something I think a lot of people really lack when they deal with chronic pain, is that their only focus is getting rid of it. And if something makes it worse, they just don't do it. And there's a lot of wisdom in that. A lot. But when it has to do with muscles and inflammation, getting your blood moving is life. Movement is life. And for me, yoga hurts. When I am in pain and when I'm struggling, yoga is painful. It is probably the worst thing that I can do in the moment. But if I am diffusing the lavender and the release, and I just focus on getting through the moves and taking deep breaths and getting my blood moving and figuring out what feels good and what doesn't, and what is a good kind of hurt and what's a bad kind of hurt. And there is a difference. I'm usually able to stretch out enough and get my blood moving enough that it does genuinely help. If you have any serious injuries, don't do this. Don't do yoga. Like, please use your discretion. Like, do not do things that are gonna hurt you. For me, like, I'm past most of the actual, like, brunt end of the injuries. That I'm not necessarily injured, I'm just dealing with the aftermath of those injuries. And so I can push through and I can stretch out anyway. And I can do these things because I'm not dealing with an injury. If you have an injury, please treat it appropriately. Okay. Number 3, take a bath. Take a good bath. Like a really good one. For me, what happens and what is really nice is I will put Dr. Teal's charcoal blend or his sea kelp blend into the water. I will add some lavender to my bath, maybe some thieves, depends on how I'm feeling, and some baking soda. And I will get the water really, really, really hot. And I will get in the water and I will literally stay there until the water is cold. Really cold. That's hard for a lot of people. And it's hard for me. Once the water starts getting cold, you tend to feel not so good about the situation and you want to get out of it because the hot water feels so good. The problem is heat oftentimes makes things expand more and it'll make your blood move really fast, which is good. Blood moving is a good thing. We talked about this. Movement is life. But it also can increase the amount of swelling that you have. The amount of inflammation that you have, etc., etc., etc. And what is really good is ice. Icing is probably one of the best things that you can do for muscle and nerve pain. It helps. Just take my word for it, okay? So ice helps long term. Heat helps in the moment. So for me, when I get in the bath, if it's really, really, really hot, I feel amazing. But if I get out as soon as the water starts to cool down, I don't feel so amazing anymore very quickly. In fact, I will oftentimes feel significantly worse. So I will stay in that water until it is cold, until it's room temperature, until it's cold, whatever the case may be. Then as soon as I get out, I dry off and then I apply these oils and I lay down with ice. Those are on really, really bad pain days. And oftentimes I will get under a heated blanket because I hate being cold. But let me tell you, ice on those kinds of injuries, to get that kind of healing, is absolutely the best thing that you can do for your body. Those are really the main things that I do. If you do those things and you do them consistently and you support your body and your body systems as much as you can, avoiding OTCs and living your life is completely possible. And I am proof of that. I work every single day. I work out every single day. I take care of my family. I am making a move across the country. It is possible. You just have to be consistent and you have to really, really want it. And so that's my last point. Want to get better. Have hope that it is going to get better. Keep positive. And when you can't keep positive, just keep moving and don't stop, because once you do, you stop living. And what is life about if you're not living? If you made it to the end of this video, you are awesome. It's a long one, so good job. I'll see you next time.